Welcome, everyone. My name is Jess Posner. My pronouns are she and they, and I am the director of the Virtual Y at the YMCA of Central New York. I am also the co-president of CNY Pride, which is one of the co-presenters of this event tonight. I am a white woman in her mid-30s with brown hair, glasses, some interesting jewelry, and a bright blue cashmere turtleneck. The background behind me is a white curtain with some wavy lines. It is my pleasure to welcome you to COVID Questions with Dr. Elizabeth Asiago Reddy, MSMD. Before I begin my introductions, I would like to share some announcements with you. Tonight's event is co-presented by YMCA of Central New York, CNY Pride, and Upstate IHS. If you aren't already following all of these amazing organizations on social media, please do so. I will say that it is a unique pleasure of mine, specifically working with the YMCA of Central New York, to have so many opportunities to work with so many phenomenal organizations within our community. And I think it really shows the strength of how we all work together and support one another and help to connect folks to the resources that we're able to provide uniquely as service providers. I would like to share that the YMCA of Central New York does have a few more very exciting events coming up next week in celebration of Black History Month, including virtual events with Michelle Jones Galvin, the descendant biographer of Harriet Tubman, and poet Crystal Williams. We also have an association-wide We Wear Black event happening next Friday. So please visit ymcacny.org/BHM2020. I'm going to put that in the chat for you for more information about these events. CNY Pride will also be making some announcements about our summer Pride plans in the coming weeks, so please do stay tuned for those. Now for this evening, we are so pleased to welcome Dr. Asiago Reddy. Dr. Elizabeth Asiago Reddy, MD/MS, is an associate professor of medicine and the division chief of infectious disease at Inclusive Health Services at Upstate University Hospital in Syracuse, New York. She is an infectious disease expert, and we are very grateful that she has chosen to share this hour with us. We are excited for her informative, science-based presentation on COVID. Following her short presentation, we'll have time for a judgment-free Q&A. I'll moderate that conversation, so you can feel free to type your questions or comments into the chat, or you can message me directly privately. We are also a relatively small group tonight. I was speaking with Dr. Asiago Reddy about this earlier, in that it's kind of interesting to watch how virtual programming has shifted over the course of the pandemic, and how actually a lot of our engagement shows up as viewing the recording afterwards. So what I want to say with that is that you will notice that we are recording tonight. However, I will edit out any identifying information, whether it be your name or your image, in that recording. If you request, I can also edit out your voice. So just let me know in the chat if you would like that, and we will do our best to make sure that you have all of the anonymity and privacy that you would like. But I also want to encourage us to have, a really personal kind of conversation with one another, because we are a small group here tonight. I think it's a really nice opportunity to ask some judgment-free questions about some of the really challenging decisions that we're all having to make, navigating now moving into year 3 of COVID. So all that being said, that recording will be posted to YMCA CNY's YouTube channel and will be shared out via CNY Pride and also shared with Upstate IHS to be made available to the greater public. A final bit of housekeeping is that we request that you remain muted unless you're invited to unmute, which just creates a more pleasant experience for everyone. So if you do need anything, feel free to raise your hand or message me and we'll make space for you. But otherwise, I am really, really honored and excited to turn over the virtual stage to Dr. Asiago Reddy.
Wow, thank you so much, Jess, for that introduction. I really appreciate you having me. It's my pleasure to be here. And I'll go ahead and get my screen shared. Okay. So are you seeing the presenter version or the correct version that you want to see?
We're not seeing anything yet.
Yeah.
No.
did our best to actually troubleshoot.
There you go.
Okay.
Perfect. Looks good.
All right, excellent. So I'm assuming that folks don't have a background on what's, certainly a scientific background. I know we have a lot of stuff coming to us in the media that can be hard to parse no matter what your level of scientific inquiry is. So I've kind of organized everything by the basics and going through one by one a little bit. And I will go a little quickly in the interest of time, and then in the interest of hopefully hearing from you all with questions. So we're going to go over some case numbers, prevention, testing, what if I get sick, and then we can review and have questions. So case numbers, I just wanted to point out the currently reassuring data that we've been looking for over the last couple of months, which is that case counts are coming down throughout the world. And this looks at cases per a certain number of people, so per million people. So if you look at sheer numbers, the United States frequently tops the list, but per numbers, we're somewhere in the midst of the countries displayed on this graph, but all of us are declining in terms of case counts, which is a welcome moment. So this just separates out the US from other countries. So you can see the kind of peaks and troughs that we've experienced since the beginning of this all, as Jess said, way back in March of 2020. So currently we just experienced the largest spike that we have experienced throughout the pandemic in our case numbers. And those are coming down quite nicely over the last couple of weeks. And we certainly hope that trend will hold for a little while. I wanted to highlight that there have been some unique features related to age for the recent spike in particular. When you look at the people most likely to have a case of COVID, so I'm not talking about going into the hospital or having severe disease, I'm talking about having a case. The green sort of aqua dots, which if you can see the graph are on the top, that indicates the group of people between the ages of 18 to 29. They've across the board been most likely to catch COVID throughout. But what's been a little bit different is if there's a dark purple line that indicates people over the age of 75, and certainly they have a very high risk of getting sicker from COVID than other groups. What happened is that that group of individuals took up the vaccine in very large numbers. And when we experienced the Omicron wave, we actually saw them as being the least likely to be affected by that wave. So that's kind of interesting. Younger individuals who were not able to be vaccinated, so your 0 to 4s and 5 to 11s, all of a sudden experienced the first very large spike that they have experienced when we went through Omicron. So what does do to actually make us sick? So the name of the virus is the SARS-CoV-2 virus, and that really just stands for serious, oh, it's supposed to be severe. Wow, I made up my own word there, sorry. Severe acute respiratory coronavirus 2. So there was another one prior to this one. And then in order to enter our body, this virus needs to go through a receptor on the surface of our cells. That's called the ACE2 receptor. So it's like a lock and key where the virus actually has to stick to that receptor in order to get into our body. And that is how we actually get sick with this virus. So we have many of these ACE2 receptors throughout the body, and not surprisingly, many of them are in our nose. So when we breathe in, the virus locks in on those receptors and starts to get into our body that way. What are COVID variants? So obviously this is something we've been battling for a long time since the inception of the epidemic. And as the COVID virus or other virus replicates, as it makes copies, it can make mistakes. So some of those mistakes are bad ones, and those variants of the virus die off. And then other variants can actually make the virus more fit. So what does it mean to make it more fit? That would be maybe the virus could stay in the air longer so that it's easier to infect other people. It could enter the body more easily. It could escape immunity from past infections. And more fit viruses will naturally take over. So that is the reason why we've seen these variants emerge. And as you can see in the following slide, we are looking at the waves of variants that have occurred since the beginning of the pandemic, with Omicron occurring most recently and really taking over completely over a very short period of time. So Delta was the predominant variant all the way from May to December. And then in December of 2022, it started out with the Omicron, and that has completely taken over pretty much throughout the world. What's unique about Omicron, there are a high number of mutations in that spike protein that makes the lock and key with the ACE receptors in our body, so that it has a higher level of infectiousness, and it can more easily remain in the air, like I discussed. It has a shorter incubation period, so after you're exposed, the time between getting exposed and getting sick is faster than it was with other variants. And it fortunately is less likely to replicate well in the lungs. So it's less likely to lead to severe disease. The risk of severe disease, of course, however, still exists, especially for the most vulnerable individuals. I'm going to talk about prevention now. Mask madness. So there's just been a lot of controversy about masking. But really, this is a very simple public health measure that is highly effective. And I boxed the area of a chart that I have listed here that shows what is especially important when thinking about masks. And that is that the masks work best for people who are sick but don't know it. Okay, so if you're sick and you know it, you should obviously be at home. But if you're sick and you don't know it, if you're wearing a mask, then that is the most effective way to make masks work. And I think most people, and certainly people on this call I'm expecting, do know this, but it surprises me how the messages have gotten really scrambled, where in a number of environments where I've gone with my family, when I bring this up, well, actually I'm going to hold off on that one, activity at the YMCA. This was several months ago before my kids were vaccinated, because not everybody's going to be wearing masks. And the response sometimes was, well, but your kids can wear a mask. And it's like, okay, but if others aren't wearing a mask, that still is a higher risk situation for them prior to vaccination. So the person, a universal mask setting is always going to lower the risk for everybody involved. And then, of course, closed, indoor, poorly ventilated locations are going to be the highest risk for spreading of the virus. So do mask mandates work? They work the best in environments where we can study them, of course, and that means contained environments. So schools are actually one of the best places to study them. And what this shows is that in September, when school started, there were several states that had mask mandates and several states that did not. And if you compare the rates of COVID in communities that had mask mandates versus for schools versus those that did not, there was significantly lower rates of COVID in the entire community. So not just in the schools, but actually in the entire community, in communities where mask mandates were in place for schools. So they actually were highly effective for students and for the surrounding communities. And this is something that's been in the news a lot lately. What about the type of mask that I wear? So this was a very large survey that was done nationally that asked the question, if you go out, when you go out of the house, do you wear a mask regularly? And if you do, what type of mask do you wear? And all types of masks were associated with a drop in risk of infection, but more significantly for those who wore surgical masks or N95 respirators when leaving the house. So if you're just trying to protect yourself in an environment where other people may or may not be masked, the type of mask that you wear can make a big difference. If the goal is really protection of other people, you can oftentimes get away with a less protective mask because it will still collect your own respiratory droplets and prevent transmission to other people. So there are some, I'm not going to go over this in detail, but I actually want to point out that there is a website of the CDC that goes over specific types of masks that they have approved by studying them, and these are publicly available. So a lot of times you can only get sort of a studied mask inside a hospital setting, but there are certain companies, and I've highlighted a link there, that create masks that have been studied by the CDC as to how effective they are, whether they can be reused, et cetera. So if you're interested in that, you can go there. And most importantly, if you're trying to protect yourself, the mask has to fit your face. It seems obvious, but that's really the most critical piece. And then you ideally want at least 2 layers of a random or tight weave fabric. All right, so we're going to move on to vaccination. So goals of vaccination initially are mainly to prevent severe disease. So vaccination has other goals that we hope for, but our main hope when we create a vaccine is that we don't want people to die of the illness they're being vaccinated against. So really, when you look in the US, and I'll show these numbers, vaccination status has become the best predictor of whether or not somebody will have a fatal COVID infection. And that shows that goal has largely been accomplished by the vaccines that are available. As additional goals, we want to be able to reduce the risk of any infection. So I don't want to catch COVID at all, whether mild or moderate or severe. So that's one goal of vaccination, although not always the primary goal. And then reduce the risk of spread as another goal. So we hope that vaccines will reduce the risk of spread. What I have here is a diagram on how herd immunity works. So when no one is immune, it's very easy for an infection to spread throughout the population. When multiple people are immune, it helps to, that level of immunity helps to protect the few vulnerable people in the population who still aren't immune. So the bottom of this graph shows a person in pink who is vulnerable to infection, but all the people surrounding that individual are green, meaning they are protected. And so that individual is no longer at risk for infection because the people around them are preventing that person from catching the infection. That's how human herd immunity works. And that's ultimately what certainly we would hope to get to. The vaccines for COVID target that spike protein that I was discussing. So that spike protein is what's needed as that lock and key to get in. And right now we have 2 different types of vaccines available. You have your mRNA vaccines, which are your Pfizer and Moderna, and your vector vaccines, which is the Janssen or J&J vaccine. All of them are containing a template for the spike protein. So that template goes into your body, and as soon as your body sees that template, it starts generating copies of the spike protein. Once the immune system sees those copies of the spike protein, then it kicks into gear and creates an immune response that helps to protect you in the future. So these are our current vaccine schedules that are recommended. And I have the mRNA vaccines on the top and the adenovirus vector vaccines on the bottom. So certainly most of the vaccines that have been available in our community have been the mRNA vaccines. So what you want for that series is to get your dose 1 at time 0. You get your dose 2, 3 weeks to a month later. If you are severely immune compromised, and there are lists on the CDC website that describe what that is, then you would also get a supplemental dose after your second dose. So that supplemental dose would occur 2 months after the original mRNA vaccine. Everyone age 12 and up now is recommended to get a booster 5 months after their initial dose, okay, for the mRNA vaccines. Now going to the bottom of this, this graph here, I have the adenovirus vector, which in our area is the J&J. So that one, it used to be thought of as a one and done, and that is no longer the case. It really also requires a booster in order to be effective. And so you get your dose 1, and then within 2 months, you can get your dose 2 of J&J, or you can flip to an mRNA. So mixing and matching of these vaccines is allowed, has been studied, and is efficacious. And this graph, I think, highlights what I had mentioned before, which is the reduction in death from vaccination in the US. So if you look at the top here, we have people who are unvaccinated. And then at the bottom, you have a red line, which shows vaccination with no booster, and then a green line, which shows vaccination with a booster. So the bottom line message here is that people who are vaccinated, even without a booster, were 97 times less likely to die from COVID up through the end of January of 2022. New York State has some great data on risk of even catching COVID at all by vaccine status. So the red line on this shows your risk of catching COVID if you're fully vaccinated, meaning you've had at least 2 doses of an mRNA vaccine. And then the blue line shows your risk of catching COVID if you have not been vaccinated at all. And there is a bump in that red line, meaning that vaccinated people during the Omicron wave were catching COVID. But there is a huge separation between the red line and the blue line, meaning that people who were unvaccinated were much, much more likely also to catch COVID. So we do have a missing group still, which is our less than fives. Age 5 to 11 can be vaccinated with a 2-dose series, but age less than 5, we're still waiting for the approval for those vaccines, which is anticipated hopefully over the next couple of months. So I've brought up boosters already, and I really want to emphasize the importance of the boosters. So I really think of this vaccine series as a 2 or 3 dose vaccine series, because most people are getting mRNA vaccines. I'm thinking of it really as a 3-dose vaccine series for the vast majority of people. Again, certainly people who are severely immune compromised will need a 4-dose vaccine series. And most of our vaccines work that way. Okay, so I know it's been very tough to hear. It seems like every few months I need another vaccine, I need another vaccine. But the reality is that when you look at most of the vaccine series that we have, that's how they work. So we start getting a bunch of vaccines when we're little. You come in at 2 months, you come in at 4 months, you come in at 6 months, 1 year. So this is actually not a surprise, really, I think, to me working in infectious disease, that it worked out this way. And that booster dose is going to raise your level of antibodies by 5 to 100 times. And of course, that's a big range. So most people are getting about 30 times the amount of antibodies from that booster dose that they had prior to the booster dose. So it's quite impressive. And after a few weeks after your booster is when you're at your prime in terms of your protection. But across the board, and we saw this from the graph before, even the first 2 doses are really protecting against severe disease that would lead to death. So that is certainly what we're all excited to find out. All right, what about vaccine risks? So there have been 10 billion doses of vaccines delivered in the world and 547 million in the US. And overall, these are extremely safe, but there are a few acknowledged rare risks. So pericarditis and myocarditis, especially in young people and with males more likely to be affected than females. That is a known risk specifically of the mRNA vaccines. TTS is a rare blood clotting and bleeding disorder that can occur, and that specifically has a female predominance and is associated with the J&J vaccine. So those are the real risks that exist, and certainly questions about those risks can be discussed with healthcare providers. And then anaphylaxis has turned out, so the severe allergic reaction has turned out to be much less likely than what we even expected initially, so about 1 in a million doses. Fortunately, data do not show increased risks for infertility, which is a big concern a lot of people had. There is a known risk of, and I wouldn't even really call this a risk because it doesn't appear to have any long-term negative effects, but a phenomenon that people who menstruate were seeing is that their menses may be delayed by a couple of days after getting their vaccine. And that appears to be a true phenomenon that has been studied, but that the cycle re-regulates itself afterwards. What about natural immunity? So natural immunity, it is when you get infected with COVID, and for the most part, 3 months after an infection, it is highly unlikely that you are going to get infected with that same variant again. So if you unfortunately caught COVID and then a new variant came along, like what happened with a lot of people with Delta and Omicron, you can get it twice in a row in a short period of time. But if a new variant doesn't come along, 3 months is a reasonable amount of time to say that you're pretty darn well protected. The problem with natural immunity is that it's highly variable. So if you look across the spectrum of individuals who get sick with COVID and test their antibody responses, they are vastly different from person to person. Some people barely make antibodies, some people make lots of antibodies. Severe illness, unfortunately, because nobody wants to go through that, is associated with higher levels of antibodies than mild illness. And so if you look at the differences between vaccine protection versus natural immunity, one of the benefits of vaccines is that the levels of protection that you're getting are more stable and reliable with our information to date. And I say that knowing that we've had a lot of ups and downs. So that's our information to date. And but it's true that over time, natural infection, it does seem to offer some protection against severe disease. And so that if people are getting multiple rounds of COVID, then over time, in all likelihood, their risk of severe disease is going to go down. And all this, I say that there are always exceptions to every rule, but on average, that does appear to be the case. Whether or not one strain, getting sick with one strain protects against the other, it just depends on what strains are out there. All right, so testing and treatment. So there are two major types of tests that we're dealing with for COVID. We have our PCR and our antigen tests. So the PCRs detect a very small amount of genetic material associated with the virus. And of course, they can be harder to get and have a longer turnaround time because of the intense amount of laboratory support that they require. And another feature that some people may have experienced is that a PCR test can remain positive for quite a long time after initial infection. And that doesn't mean that the person is still infectious. So if you test PCR, people 10, 14, 21 days out, many of them are still going to have a little bit of detectability there. But pretty much after 10 days, the likelihood of spreading to anybody becomes essentially zero, with, again, some rare exceptions. An antigen test tests for viral proteins. It's easy to conduct at home, as many of you might have experienced, but it is a little bit less accurate than the PCR. So it can miss about 20 to 30% of infections, especially early on. Some people have argued that the antigen test is a better way to predict during the phase of infection who might be the most infectious, with people testing positive on antigen tests maybe being more infectious than others. And that's still somewhat controversial, but there likely is some truth to that. All right. So if you're sick and you're test positive on a rapid test, this means you have COVID. Okay. And, basically 99, 100% you have COVID. So when an antigen test turns positive, you can trust the result. It's when it's negative that it can be tricky to interpret the result. But if your antigen test, you test it at home and you see those two lines, that means you have COVID, and you should isolate at home. Everything is changing with respect to the health department. And so really it's a matter of going through the health department website or calling the health department to find out what you might need to do in terms of quarantine and isolation. On another slide, I have what's most recently recommended. And these days, actually, you would be requested, if you're able to take a picture of your test and submit that to the health department so that they have that information, because otherwise, if you test it at home, the information is not going to go automatically to the health department like it would if you test it in a lab. And if you test positive and you're immune compromised, unvaccinated, or you're concerned about your symptoms, then definitely you should contact your health provider. Now, what if you're feeling sick and you test negative on a rapid test? So in that case, you still should remain masked around vulnerable people and repeat your test if possible over the next couple of days. I know for a while those tests were very scarce, and they are a little bit more available now, because the rapid tests are more likely to turn positive during days 2 and 3 of the illness. So it's better for you to try to test again if you're able to. And then also, if you're concerned, you can go to a PCR test at that point. So if you're still not feeling well and you test negative on a rapid test, if you're able to access a PCR test, that would make sense. And that especially makes sense if you've had exposures or you're unvaccinated. All right, so here's the current isolation and quarantine. Everyone's heard about this 5 days, and that's great, but it's important to remember that the recommendation is actually still that for the remaining 5 days, if you've tested positive, you should wear a mask around others outside of your home. The reason they say outside of your home is that there's a presumption that you may have already exposed people within your home. If you don't think you've exposed people in your home and you can separate yourself reasonably from people in your home, then you can always choose to do that as well. So it's 5 days of strict isolation at home and then 5 days of mask wearing after that. And it's kind of confusing for a lot of people as well that day 0 of your isolation period is the day that you very first notice that you felt symptoms, or if you had no symptoms, the first date that you tested positive. And then after that, you start counting the 1, 2, 3, 4, 5. These days, if you're exposed, you actually are able to avoid home quarantine, meaning so like you don't know if you're sick or not, but you were close to somebody who is sick. You don't have to stay at home if you've been fully vaccinated, meaning you've got at least 2 doses of the mRNA vaccine, but you should wear a mask in public in that setting. So honestly, for me, I'm sort of okay with somehow dropping the mask mandate. There's certain elements that I think are fine. This one worries me a little bit because we've kind of linked this whole reduction in cases in the community with this more rapid exit from isolation. And I'm not sure that everyone understands this fully. So it probably still is important to get this message out that days 5 through 10, people should be wearing a mask. All right. Now, what can you do if you test positive and you are at risk for severe disease? We have a number of new treatments that are available that are incredibly effective and that can be given to people who are at high risk for progression to severe COVID. So probably the most important one for people here would be this one called nirmatrelvir ritonavir. It's also known as the brand name Paxlovid. And this reduces the risk of progression to severe COVID by 88% for people who start it in the first 5 days after testing positive. And these are people who at baseline should have high risk of progression to severe disease. And so again, I just highlight this here, the Paxlovid, and this other one called molnupiravir, which is a little bit less effective, 30% reduction, but still something. You want to give these within 5 days of symptom onset. There are also infusions through IVs that can be available to people who are at severe risk of severe COVID, and these need to be given within 7 to 10 days of symptoms onset. So these are one of the reasons why I mentioned if you're a vulnerable person due to your immune status or you're unvaccinated, you should call your health provider if you test positive because you may be able to access one of these treatments. So the people who are going to benefit the most from those treatments are people with severe immune compromise, people who are unvaccinated, especially with increasing age or comorbidities, older age, over the age of 65, and pregnancy. So pregnant people really have a very unique risk of severe COVID. And it's especially important that pregnant people do get vaccinated, though there have been a lot of fears, understandably, for those individuals to uptake the vaccine. I know it's always scarier to do something when you're thinking about somebody else who's very, very vulnerable inside of you. But the vaccines have demonstrated safety for pregnancy. Nonetheless, it remains a high risk period. So I just want to highlight that to make sure that people are aware. All right, so can we go back to normal? I think to me, one of the critical features through all of this is accepting that we're in a state of flux. So I think we just need to realize that we are likely to have seasons of COVID where things become more difficult in the future. I always hope that this is a little bit like dropping the stone in the pond where, there's the first few ripples are pretty high and then the ripples get lower over time. And that's certainly what I think that is what's going to happen. But I also acknowledge that there's an element of unpredictability that I think we all have to face and acknowledge. So I think that accepting that there are going to be seasons of risk where we need to change our behaviors is important. And instead of kind of just being like, I'm done with COVID. And that will hopefully help us to acknowledge that that is a reality, but then also to make the most of the times when things are going really well and to be safe during the times when things are more risky. And I think that always involves, just like with anything else that we do, conversations about your comfort level and the comfort level of those around you. So when it comes to, going out, meeting people at homes, going to small gatherings, then it's really like, I think it should be okay with people, especially people that you know and care about, to discuss what people's concerns are related to risk and to try to do your best to respect those and using a lot of the different tools that I've talked about. So making sure people are aware of treatments that are accessible to them, helping people who might need to access a vaccine, just whatever it might be, that all those conversations can occur. Wearing masks or allowing somebody who's especially vulnerable to wear a mask, et cetera. So really when it comes to people who are more vulnerable and immune compromised, then those individuals, you can help them by making sure that they are aware of the extra treatments potentially available to them and what masks might potentially help them from being exposed to the virus. So that is it. So we've really come a long way, a very, very long way. And I feel it strongly that the vaccines remain a linchpin in this, even though I acknowledge that they're not perfect, but they are incredibly effective at preventing severe disease and death, and particularly when the booster doses are added on. And then I'm really happy that we now have these newer therapeutics and options to add to the armamentarium. So I hope that gives everyone some time to ask questions, and I'm happy to take them.
Well, thank you so much, Dr. Asiago Reddy. If you want to stop screen sharing, then we can get sort of like a bigger view of your face while we have this conversation. And I'll also spotlight myself so it feels a little bit more conversational. But I'd love to invite everybody in the group to put your questions or comments in the chat, or you can also raise your hand. Feel free to unmute, because we'd really like to spend a little bit of time having a conversation that's generative. I noticed that there's a lot of folks who volunteer as members of the board of CNY Pride who are joining us tonight. So maybe we can also have some questions specifically around some of the things that we're doing, because I think that might help us, specifically to inform how we move forward with events. But I suppose the first question, the first thing that I'd like to do is I'd like to extend the gratitude that's coming into the chat from one of our guests, saying that was incredibly thorough, and just thanking you. And I'd also like to say that too, that was an incredible amount of information that was presented so clearly in a straightforward, accessible, and non-judgmental way that I personally really appreciate it. And I think our community will also appreciate it. So thank you so much for the work that you've done to prepare for tonight. So one of the questions that I'd love to get started with actually is just questions around, like what are the kinds of things that you weigh or that you evaluate when you make choices for yourself and your family? So when you go out either to a public space or a home or something like that, like what are just the elements or the factors, right, that you evaluate to decide whether or not you and your family are going to do something?
Yeah, so I think a lot of it comes down to what the status is of the people that you're with and how risky things are for them. So for a lot of the pandemic, I'll just speak, I'll speak personally. For a lot of the pandemic, I was very, very conservative because I had family members at home, like one family member who has an immune compromising condition, and then young children. And so I was quite conservative about things that I did with concerns that those individuals might be exposed. And so when things really changed for me was first with being able to protect my spouse and myself through vaccines. So that was really a huge game changer at the point that we felt that we had achieved the accessibility with vaccines and been fully vaccinated. That allowed us to start doing some things that we hadn't done. At that point, we still didn't go, it depended on the season, we still didn't go to indoor restaurants or bars, but we did start doing activities in big places where, like I felt comfortable, for example, going to a mall with a mask on at that point because it's like a wide open space where close encounters are a lot less likely to happen. So that's some of the things that I think about. And then over time, it's like as most of the family members have been able to be vaccinated, then it's made us feel a lot more comfortable. And then I start to think more about, okay, so now am I going to be soon getting together with any other people or family members who are more vulnerable? So, okay, maybe I don't want to go out to a restaurant this week because I know next week I'm going to go see my great aunt. And I'm worried about her. So I'm going to kind of keep that in the back of my mind. Whereas like, hey, it's June, it's beautiful outside. There's a concert going on. I am all about that and I'm going to go. So it's putting all those different little pieces together of who are the people in your circle, who you're thinking about, and then what's the setting and what's happening at the time.
Thanks so much. I see that we have a question coming in, but I want to ask a quick follow-up question. So in terms of like an outdoor event, maybe happening in June where it's really beautiful, that is something that we are working on.
Indeed.
Well, thanks for that setup. But I guess, as organizers, it's something that and none of us are medical professionals, we are hungry and excited to, learn the best up-to-date information that we can, consult people in the community who can give us, the best opinions. But what kinds of things would you recommend to event organizers who, for example, specifically for our purposes, are organizing an outdoor event that is expecting to draw a couple thousand people in the summer?
Yeah. So actually, I think outdoor events are actually incredibly reassuring in terms of their level of risk. And I think we've seen that in a couple of different scenarios now where there have been big gatherings of people. And as long as they really are fully outdoors, the risk actually is impressively low. So obviously, if you're like, if you're body slamming with people and in very close quarters, even outdoors, of course, like, yes, you can potentially become infected, but more it's like the very close conversation. So, sitting at a table across from somebody without a mask for, several minutes, close, that type of thing, outdoors, potentially. Yeah, potentially. But as it relates to the big group in terms of saying like, is it safe for us to have this event because are we putting the community at risk? And I think the answer to that at this point is really no, and that we can be reassured that that having these types of events is important community building, and that we're by and large not putting people at risk. I think it is helpful to allow people who do have more vulnerabilities to access information about the types of masks that they can wear, and potentially like even maybe if there's any kind of like funds to allow people to access masks, because right now it's still hard for some people to get something that actually amounts to an N95. And if somebody really is vulnerable and worried and they want to wear one, it would be great if there's ways that people could be able to access them, at least saying, hey, this is where we found that you can access them for a reasonable cost or something like that. So they can facilitate somebody who's worried about protecting themselves and doesn't feel comfortable enough that other, means of protection would be enough.
Thank you. That's really helpful, and something that we'll definitely do through CNY Pride as part of our promotions, in terms of helping people protect themselves, protect others. But I love the idea of making links and/or the items themselves accessible and available to the community for those that need them, and for those that want them. So thanks for that. All right, we've got a couple meaty questions in the comments here. So the first one comes from Denise and says, thank you for sharing your knowledge. I'm curious on your opinion about school optional masks. In August, Upstate pediatricians sent a letter advocating for school masks. In light of recent events, do you know if they plan to do something similar?
Oh, we had a very heated several days series of emails back and forth about this. And yes, at this point, the pediatric infectious disease, I think I feel very comfortable speaking for them, since they're my close colleagues, feel that the mask mandate should remain in place for our schools. But they actually are willing to consider, if we continue to have sustained caseload, whether it would make sense in a few months to lift it. And the numbers that have been floated are more like a sustained percent positive of less than 3%. So when you look at all the people testing, when you get to less than 3% of them actually showing up positive, that's been shown to be associated with a very low level of cases within the community, and where things would probably be safer. And I'm going to dovetail a little bit on what Andrea's comment said in my comment to Denise and everyone else about this, which is that, I think a lot of it comes down to how burdensome do you think masks are in schools, and what's the risk to everyone. We're still gathering some information about this. So burdensome, I mean, I've asked my kids this and they're like, nah, like, I mean, it's like, they're kind of like, well, it'd be kind of cool to do sports without masks. That's it. Like, they are not very burdened by this. So, and that's been by and large my experience with other kids, is that if you don't make it a burden for them, they're not that burdened by it. And the nice thing is that when you have a universal masking situation, as I was kind of alluding to before, a less protective mask can be worn, and that's a lot more comfortable. So you can wear a light 2-layer mask or a surgical mask. Those are pretty darn comfortable. And if everyone's wearing them, it's outstanding protection across the board. When you start popping off masks and there are multiple people not wearing them, then those few that are less protected, right? So then the surgical mask might not be as good. It might not be as effective. So it really, I think it's important for us to make these decisions, recognizing that they have significant consequences for the most vulnerable people. So those who really feel very worried about their level of protection, once everyone else starts popping off their masks, those individuals are going to have to spend their whole day in N95s. So, do we want that? I mean, we need to make that decision. Do we want that? Is that okay? Is it okay that some teachers are probably going to feel they need to wear N95s all day because of this? So, I think it's a very tough decision. And I think what's going to really help is that now that this Omicron wave has ceded for the time being, when we look back and say, what is your risk of severe illness or death if you're boosted, but you have various health conditions? Because some people don't honestly really know, and believe it or not, epidemiologists don't know on an individual level. Like, we need more risk predictors so that I can say, okay, I have the following health conditions. I'm boosted. So what is my risk of severe disease? It's like 0.05%. Okay, I'm willing to live with that. I'm going to move forward and say, you know what? It's okay. Other people might not feel that way, but I think the way that I think it makes probably a little bit of sense to look at it is we've been living with the flu for a long time. The flu is not, there are unfortunately people who succumb to the flu every year, but we felt that the level that we were at was reasonable, where we could live our lives and we could recognize that some risks are going to occur. So I think if we can get close to saying that between the vaccines and therapeutics, that the vast majority of people are at a similar level of risk to what they had with the flu, then it's probably reasonable at that point to open things up more.
Thank you so much, Dr. Asiago Reddy. That was a very comprehensive answer to both of those questions. And I think really helpful for understanding, the calculus really that many of us have to do to understand, what our risks are, what risks we're willing to take, and I hope that we'll get to a point in the near future where we'll be able to understand that. A few more things coming into the chat include something that Andrea mentioned in terms of wondering about these things, as her father is 82 and in excellent health, but also has asthma and COPD, but is vaxxed and boosted, but also 82.
Right. And in all likelihood, it appears that his risk is pretty darn low, although it's higher than somebody who would be 20 years younger than him. But yes, those are the exact data that we need, is kind of building in some profiles of people and then being able to say, hey, this is what things look like during the Omicron wave. And I know that a lot of data crunchers are trying to get that data out.
Okay, thank you. We also have a question coming in from Donna, who says, as a person who has been known to be a carrier and not a getter, for lack of better words, they are vaxxed and boosted and want to know thoughts on someone who is a carrier.
Yeah, I mean, I think you've done what you can do in terms of getting vaccine boosted. So that does, obviously, we've seen that people who are vaccinated, unfortunately, because of variants, can still spread COVID, but the risk of spreading is definitely lower on average than people who are unvaccinated. So people who are unvaccinated tend to have higher levels of virus in their respiratory tracts that could transmit more easily. And so I think really if somebody, it sounds like maybe you've had an asymptomatic infection in the past. And so it's nerve-wracking to say, like, what if I have an asymptomatic infection in the future? I think somebody in that position can't be expected to test themselves every week or every day to find out if they in fact have another asymptomatic infection. I think I would just go by the situation that you're in, whereas if you have really a known close exposure and you'd actually be considered exposed to COVID, then you should test. But otherwise, I think you've done the things that you need to do to keep yourself and others as safe as is reasonable.
What about other kinds of events? Like, let's say, whether it be small family gatherings or, a medium-sized kind of event, would it make sense for folks to do tests beforehand to just kind of know? Okay.
Yes, absolutely. I think that rapid testing before events can be really helpful, as long as, like I had mentioned, when you have conversations with the group, everyone understands that they're not perfect. So, I've experienced this with friends and family where things have not gone exactly according to plan, but the effort was there and we all understood that. So you're still going to have a lower risk if everybody tests beforehand and is negative. And ideally, the closer that you can test prior to the event, the better. Because as we said, the rapid tests kind of evolve over time.
So let's say someone was planning a small wedding or something like that, or a family reunion, with under 100 people. What might you recommend to that group of people, in terms of like a testing protocol, to try to make sure that things are the safest for, everyone attending?
Yeah, I mean, with the rapid test being right now more available, it actually presents a good opportunity to make those tests available to guests. Even, you could mail them to the guests, for example, and say, hey, please do this test prior to coming. As to whether or not you would want to have a vaccine requirement, that certainly is an individual decision for the wedding party to decide, since that's obviously very late in and et cetera. But, that's their prerogative to make that decision, and that would overall reduce the risk. But I think, having everybody access the rapid test and say, hey, we're asking you in good faith to please do this test before you come to protect yourself and others, I think that's very reasonable.
All right. Thank you so much for that. Does anyone else have any questions or anything they'd like to ask? Oh, let's see. We have a question from Franco who joined a little bit late and asked, how long will the booster shots be effective for? And do you think that we'll need more booster shots?
So, there were a couple of news flashes over the last couple of days saying, oh, the boosters are waning. So obviously I was not very happy to see those news flashes. I read the study from the CDC that all of that came from, and I have to say I'm in waiting mode right now. I'm not super convinced by the results of that study. There were a lot of caveats, a number of caveats about the data for a number of different reasons, in terms of like the timing between Delta and Omicron and when people were getting their boosters. And once the data analysts have to start adjusting for 15 different factors, I start to really wonder how much to read into the study. So, I mean, I think the CDC is an incredibly difficult position because they're trying to be very honest and straightforward. And yet at the same time, the complexity of the data they're analyzing is beyond even epidemiologists at times. So, so it gets to the public, and then the public's like, well, great, even the boosters don't work, so it just, it's difficult. It's very difficult. But my read on that is that I think we can wait and see. I think as all of the data for severe illness and death are extremely reassuring to date. And that's even for the people who had their 2-dose series ages ago. And when you test those people's vaccine, people who had 2 doses of mRNA, like more than a year ago, when you test their antibody levels, a lot of them are pretty bad. But across the board, they were really, by and large, like more than 90%, 97%, or 97 times more likely to be protected against severe illness and death. So I think we're going to be in a better place with the boosters than the recent reports would suggest.
So no definitive answer to that yet, but stay tuned. And, one of the things that you did mention early was that we're in a state of flux. So we, continue to learn as we go. And it does seem that we're learning a lot more, at this stage than early on, which I remember those days. I was one of the unlucky few that had OG COVID before tests were available, even in hospitals, really. So it is kind of cool that I have, 10 free tests this month from the government, right? That I can use to protect myself and others. Let's see, we've got 2 more questions. So one, which is just like with the wedding guest question. So about the best time.
Yeah, I mean, I hedged on that one a little bit because my mind started going in a bunch of different directions, which is like people are traveling to the wedding. It's so, they're probably going to have to test on the airplane. So there's a whole bunch of different factors that kind of came up in thinking about that one. I mean, again, the reality is the closer time that you test in before your engagement with other people, the better. So it kind of comes a little bit down to people's willingness to have the possibility that they travel to a wedding and they can't attend it because they test positive. But that would be the optimal thing to do, is to test as close to the time of the wedding as possible. And again, because if you're traveling on an airplane, you probably would have tested anyway prior to getting on that plane. The likelihood that you're now going to test positive prior to the wedding gets a little bit lower.
Yeah. And probably, I've been thinking about things like this too. And, if you are going to be with high risk people, like you used the example of your great aunt, you might go back to some of those more severe, or maybe not severe, but more conservative kinds of things where it's like you might get tested and then isolate before you see that person, to kind of like really use some of those original, more conservative kinds of tactics to protect people. And those tactics are still always pretty much going to work, right?
Absolutely.
All right. So one other question that we have, and then we're at 6 o'clock, so then we're going to wrap up. But do you know of any other variants that are causing issues anywhere else in the world right now?
Yeah, so far there's no major signals. There are variants that are popping up here and there, and the BA2 was kind of this sub-Omicron variant that kind of appeared over the last several weeks, but has not made very significant waves anywhere in terms of it got all meshed together with the main Omicron wave. So I think we're really in a little bit of a holding state. Now, of course, like in order for a variant to emerge, there has to be enough susceptible people to catch that variant. So the hope is certainly that as we all add additional layers of immunity, that there is a lower population of people to get sick with a variant that can catch like wildfire the way Omicron did. And again, I say that with a caveat of we've been surprised before, but that's our hope, is that that real wildfire might be a little bit more difficult, given hopefully a better state of immunity for a lot of the globe at this point.
Well, thank you so much for that, Dr. Asiago Reddy, and for everything tonight. This was so informative. It was so interesting, I could think of other superlatives to come on, but it's really been such a generous hour that you've shared with us tonight. And I personally am so grateful for the information and for the science and perspective that you have offered all of us that are here with you live tonight, but who are also access this with a date stamp on it on the internet as of like this information is valid as of this date.
I know, right.
But I just wanted to thank you so much and really extend so much gratitude from both CNY Pride and from the YMCA of Central New York. And as I always do, I would like to ask if there are any final words that you'd like to leave us with.
Oh, I think it's just fabulous that we have CNY Pride as an organization in our area. I want to thank you all for the work that you do. And I mean, for my family, it's meant probably more than you can imagine, given a long history and trajectory to come from where we came from to where we are now. So I'm really grateful to you all and the work that you're doing. And I'm grateful that you allowed me the opportunity to speak with you this evening. Thank you.
Well, thank you so much, Doctor. And thank you so much, everyone who joined us for tonight. I
did put my email in the chat as well, so that if people want to email me, that's fine, you can. Just depending on how busy I am, I take a couple days, 1 or 2 days for me to get back to you. But I really do welcome your questions. And I know there are a couple of things that maybe people didn't get to have answered. So you can always email me.
Well, thank you so much. And I will say I am a patient at Upstate IHS, and I highly recommend it to anyone who qualifies. It's the best care I've ever received. So thank you for that work as well. All right, everyone. Have a great night. Thank you so much.